Welcome back. Talking about COVID and everything that goes on with that, we are joined today by Dr. Michelle Tarbox, who is with the Lubbock County Medical Society and also an assistant dean with the Texas Tech Medical. Now, Dr. Tarbox, we're talking a little bit about personal care during all of this quarantining. What does that entail?
The things that I'm trying to focus on right now are being simple, streamlined, and safe. So we all love a big fancy beauty routine. We all love to look our best. But the fact of the matter is, in this unusual time, we need to focus on being the safest possible while still trying to take good care of ourselves. And so my routine has become extremely simplified. I've actually taken everything I don't need off of every surface that I can so that I can make sure that it is as clean as possible. And I am trying to focus only on the essentials. You can probably tell that right now I do not have any jewelry on. I also am wearing my glasses, which is not my usual routine, because that's going to make me less likely to touch my eyes. People who wear contact lenses touch their eyes much more frequently than people who wear glasses or do not wear contact lenses. And so in this time where we're trying to stay safe, I am trying to emphasize to patients that really, in this moment, it is truly form over fashion.
That I didn't even think about any of that at all. Of course, I put my contacts in this morning and I've got jewelry on. Didn't think about any of those things. Does this help keep us a little bit safer when it comes to like the spread of germs?
Anything that you can avoid touching repetitively is going to add an extra layer of safety for your routine. The things that we know about this virus are that it likes smooth, hard surfaces. These are going to be our desktops, our tabletops, our kitchen surfaces, or our bathroom sinks, our mirrors, even our jewelry, or potentially our makeup devices. We want to be really thoughtful about what we touch and what we put near our faces in this time. And anything that we can keep away from our eyes, our nose, and our mouths in this unusual moment is going to be helpful, because this virus's entry points are those mucosal surfaces. And anything we can keep away from those areas is going to benefit us.
Very good. Now, talk about what y'all are doing at the hospital. Of course, y'all are wearing all the different masks and everything. What are y'all doing to help kind of prevent, the spread of germs there as far as the masks go?
We're doing a lot of the things that we've always done, including really good strict hand hygiene, appropriate use of masks and personal protective equipment. But one of the unique things that has become part of the forefront of our response to this unusual circumstance is the utilization of handmade mask covers. And I want to give a big shout out to the members of our community who have been helping us to put these together. So these are actually fabric mask covers. Now, for those members of our health care workers, these are going to be helpful to preserve our personal protective equipment. So these will go over our masks, over our N95s, over our respirators to help us to preserve those for future use. But these could also potentially be useful for members of our society just to protect themselves and their daily goings and comings when they're going to the grocery store or going to take care of their children in any kind of childcare setting or going to pick up items that they really need. Really, we need to start to take a cue from societies that have weathered this storm before us. And a lot of those are going to be more Asian societies that have become more accustomed to wearing masks to protect their face. Our community members are working very hard to make this kind of mask to help to protect both our healthcare workers and those members of the public. And really, as we go forward in this time, protecting each other from our own respiratory secretions is going to be beneficial in limiting the spread of this virus.
I think it's genius. And, you're right. The community has done so many different things to help out you guys on the front lines, and we certainly appreciate that. Dr. Tarbox, anything else, that we can keep in mind with, our daily schedules and taking care of ourselves?
The thing that I want to emphasize is that this virus is not invincible. This virus is RNA surrounded by a lipid envelope and protected by proteins. And that lipid envelope can be dissolved by simple soap and water. We can fight this thing by washing our hands and using appropriate hand hygiene. And I cannot emphasize that enough. The power to defeat this is within our means if we will all utilize that uniformly. These masks can be washed using normal detergent, and that will help to dissolve the viral particles. We can help protect each other and protect ourselves, and the more proactive we are, the safer we will be.
That's right, and the sooner this will all be over for everyone.
Yes, ma'am.
Dr. Tarbox, thank you so much for joining us. We certainly appreciate it, and all the advice as well. You stay safe out there.
You as well. Thank you so much.
Of course. Y'all don't go anywhere. Sports is next.